Hi, I'm Molly Sullivan with Tennis MD, your source for all your tennis health, fitness, and injury information. Tennis players are prone to Achilles tendon injuries. They can happen suddenly and without warning. The pain and injury can often cause tennis players limited mobility and misplay. Today we visit Dr. Rhonda Bacharan, sports medicine orthopedic surgeon and athletic trainer, to tell us more about Achilles tendon injuries.
Achilles tendon injuries run the gamut from a simple strain to inflammation to a complete rupture. The Achilles tendon is the cord that attaches the calf muscle to the heel. Usually a sprain is a ligament structure that has been injured, and a ligament connects bone to bone, and a strain is a tendinous structure that has been injured, which connects a muscle to a bone. The Achilles tendon can get irritated or inflamed from overuse, biomechanical factors of the foot, and or overuse microtrauma. A complete rupture can occur from a predisposed placement of the foot in a planted position with a high extensile force that then creates a rupture into the tendon. The symptoms can be as extensive as a complete rupture where an athlete may not be able to walk or dorsiflex or pull their foot back, or as simple as just an inflammation of the tendon where contact to the tendon, push-off activities, and running activities may be symptomatic. Usually an athlete can play with an Achilles strain or a tendinitis if the symptoms aren't significant. Of course, if it is ruptured or partially ruptured, an athlete will need to be off of play until it is surgically repaired.
Treating Achilles tendinitis should start with an evaluation of the lower kinetic chain, which starts from the hip. There are new studies out there indicating that hip deficits can cause problems in the foot. We also need to look at the calf, since the Achilles connects the calf muscles to the heel. And if we have some weakness there, that could be a cause of some of the problems. We also need to look at the foot and ankle because overpronation has been associated with Achilles tendinitis. Then we need to look at treating the tendon itself, which could come from stretching. Some people blame it on tightness of the tendon. And then also pain-relieving modalities such as infrared light energy I've had a lot of success with lately. So if weakness is one of the etiologies or causes of the Achilles tendinitis, then you really need to focus on strengthening those muscle groups, which is going to take 6 to 8 weeks. In addition to that, the inflammation probably is going to take at least 4 to 6 weeks to calm down because, again, you're always on your feet. And if the problem is caused by overpronation or these other things I talked about, that every time you put your foot on the floor, you're going to aggravate that tendon again. An Achilles rupture usually requires surgery to pull the two ends back together again. And the rehab on that is rather long. I've been able to get back my athletes within 4 months following the surgery.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with TennisMD.com. Remember, at TennisMD, health equals performance.